Magnesium may not get as much attention as some other nutrients, but when it comes to brain function and mental health, it plays a surprisingly powerful role. And unfortunately, as many as 70% of people have some level of deficiency due to stress, alcohol, smoking, and inadequate dietary intake. This essential mineral is involved in over 300 biochemical reactions in the body, many of which directly impact the nervous system. In the brain, magnesium helps regulate neurotransmitters like serotonin, dopamine, and GABA, all of which influence mood, stress levels, and emotional balance. Stay tuned as we look at your brain on magnesium. Welcome to the channel. My name is Gary Carlson, a health researcher working full-time in physical therapy. One of magnesium's most important roles is calming the brain by regulating NMDA receptors in the amygdala, which you can think of as the brain's fear center. These NMDA receptors help control how brain cells communicate and how excitatory signals are managed. Without enough magnesium, the brain can become overstimulated, leading to symptoms like anxiety, restlessness, irritability, and poor sleep. Over the past decade, research has increasingly linked magnesium deficiency to mental health concerns, especially depression and anxiety. Several clinical studies have found that people with low magnesium levels are more likely to experience symptoms of depression. In fact, a 2017 randomized control trial found that magnesium supplementation improved symptoms of mild to moderate depression and anxiety within just 2 weeks, comparable to some antidepressants but without the side effects. It does this because when it blocks NMDA receptors, as we discussed a minute ago, this helps to increase levels of BDNF. That's one of the compounds involved in neuroplasticity, meaning it helps your brain grow new connections. I'll have more videos on BDNF in the future, but it stands for brain-derived neurotrophic factor, meaning that it's a compound that helps grow new connections in the brain. You can think of it as brain fertilizer or Miracle-Gro. So magnesium also supports the body's stress response system by reducing cortisol, the stress hormone, and helping to regulate the hypothalamic pituitary adrenal axis, which plays a central role in how the body manages chronic stress. The HPA axis is a communication center. One of its roles is to regulate fear and anxiety signals. Magnesium is also critical for sleep quality, something deeply intertwined with mental health. It supports the production of melatonin, the hormone that helps regulate the sleep-wake cycle, and promotes relaxation by binding to GABA receptors in the brain. And poor sleep, as you may know, can worsen anxiety, depression, and cognitive function. And people with insomnia or high stress often benefit from magnesium-rich diets or targeted supplementation. There's also growing interest in magnesium's role in preventing or slowing neurodegenerative diseases like Alzheimer's and Parkinson's. Preliminary studies suggest that magnesium may protect brain cells from oxidative stress and inflammation, two key drivers of cognitive decline. And while this area of research is still evolving, the early data is promising. So when it comes to recommended daily intake, the daily value for magnesium varies by age and gender. For adult women, it's around 310 to 320 milligrams per day, and for men, about 400 to 420 milligrams. And many people fall short due to modern diets, rich in processed foods and low in magnesium-rich whole foods like leafy greens, nuts, seeds, legumes, and whole grains. So supplementing can help, especially for those with absorption issues or higher stress loads. Magnesium glycinate and magnesium threonate are often recommended for mental health because they're well absorbed. And magnesium threonate is particularly effective at crossing the blood-brain barrier. Not all magnesium forms are created equal. Magnesium citrate is also popular, but it can have a mild laxative effect. And for side effects, magnesium from food is generally safe and well tolerated, but with supplements, the most common side effect is loose stools, especially at higher doses. And this is more likely with magnesium oxide or citrate, which are less absorbable forms. But people with kidney disease should be cautious with magnesium, as impaired kidneys can have trouble clearing excess magnesium from the body. While serious side effects are rare, very high doses can lead to magnesium toxicity, which may cause low blood pressure, confusion, muscle weakness, or irregular heart rhythm. Magnesium is crucial for regulating your heartbeat. So it's always wise to stick to recommended dosages and consult your healthcare practitioner before starting a new supplement. So whether it's through a healthy magnesium-rich diet or targeted supplementation, supporting your brain with adequate magnesium could be one of the simplest and most effective strategies for long-term mental wellness. If you found this video useful, please consider subscribing. As a new channel, subscribing simply tells YouTube to share this content with more viewers. Thanks for watching, and be well.